So National Primary Care Week is probably my second favorite week of the year, only behind Congress of Delegates and FMX. But that's just because I'm biased. So National Primary Care Week is originally started in a couple of years ago by the American Medical Student Association. Basically, and the goal was to really engage particularly physicians in training and medical students across the whole health spectrum about primary care and the importance of primary care, and how primary care is really sort of the foundation to the entire healthcare system. So regardless of what specialty you are, you interact with primary care, you rely on primary care in so many different ways. So that was kind of how it originally started. There's a whole bunch of other organizations which have now sort of got involved and got on board. The American Academy of Family Physicians does quite a bit through their family medicine interest group. The primary, drawing a blank on the name. I'm drawing a blank. Anyway, a couple other organizations involved that have been helping out as well. But it really, American Medical Students Association deserves sort of a shout out here as well for kind of getting this off the ground and getting this going. So they have a bunch of great events and webinars going on this week. You can go to amsa.org/events and get links to all the different things. So on Monday, Dyke Drummond is addressing burnout in the medical students and kind of recognizing early signs and symptoms and prevention techniques. He's a great speaker on physician wellness. I've heard him a couple times myself. He's a national expert on this. Tuesday, Dr. Neil Bard is doing a nutrition component, how nutrition and medicine and a healthy lifestyle are so critical. Wednesday, Dr. Joey Johnson is the AMSA president. He's doing a Facebook Live session on the importance of diversity in medicine and why it really matters. Lastly, Thursday, Dr. Smith is doing a rural health and telemedicine and talking about how telemedicine is really unique to rural health too, in terms of getting care to these remote areas where they may not have a lot of specialists or subspecialists or whatnot, and how primary care plays such a critical role. And then lastly, on Friday, Dr. James Loomis is talking about sort of lifestyle medicine and one of my personal favorite topics, sort of exercises medicine and engaging patients in preventive medicine, and how you as a physician can be healthy as well. So those are the AMSA events. And then the Family Medicine Interest Group through the Academy of Family Physicians is doing several events as well. Monday, they have a rural health webinar with Dr. Schmidt and Johnson. On Wednesday, they have a AFP chat for those of us who are Twitter fiends, talking with several of our leaders within the Academy. President-elect John Cullen and Board Chair Dr. John Meggs will be chatting live about primary care.
What?
Yeah, Wednesday? I know. Can you believe it? Wednesday. 9 p.m. Eastern, 6 p.m. Pacific. Are you around? What's your schedule?
We're going to have to crash that, and then you and I will probably have to do like a Facebook Live commenting on the AFP chat.
I think we should do that. I think we should Facebook Live and chat at the same time.
That's right. Get people, and they can get our commentary on what the AFP leadership is chatting about, and we can debate on whether they're actually tweeting or if they're having AFP staff tweet for them.
Oh, that's a good one. We could see if they're how the GIF game is as well, if there are enough GIFs or not.
I totally asked that question. I asked that question because there was, I was sitting right behind one of the presidents. I won't say when, because then that would out them. I saw a tweet come out and I was like, hold on a minute. I didn't see the guy move. And I thought, well, how is that? So I asked the question, and he really has learned how to tweet where we can't tell.
Wow.
Pretty
amazing. Yeah.
It is amazing. He was sitting like this, but the phone was like on his lap and he didn't move whatsoever, and he was able to tweet. Amazing. And his head didn't even look down. It was like that. And
maybe that's what happens when you get on the board. You get a little chip in your head, and then you can tweet.
That media training is outstanding. That's some pretty outstanding media training. That's for sure.
Wow. Huh. So I'm sorry I interrupted you. So I got stuck on Wednesday 9 p.m. So yeah, what else you got?
And then Thursday, Dr. Isabel Lowell is a founder of QueerMed, and our very own Dr. Natasha Buyan is leading a webinar about telemedicine and really using telemedicine to kind of meet patients where they are. Yeah, love her. Meet patients where they are, kind of engage communities where they are, as opposed to forcing people to spend half a day coming to the office and seeing us. And we love seeing them, but more and more, I think people are interested in telemedicine and Facebook Live events to learn more as well. So it's going to be a great week for sure.
And Alex, did you look up some fun facts for National?
I did. Okay, so people are like, oh yeah, primary care, yada yada yada, whatever. So our good friend Dr. Glenn Stream over at Family Medicine for America's Health, he wrote this great article a few months ago in Medical Economics talking about making the dollars and cents argument with primary care. I mean, we have, for those of you who haven't been paying attention, we have a healthcare cost crisis in this nation, really. So it's like, how do you reduce costs? How do you improve the health of our nation and improve their care? So, he put this article together, talks about, primary care. A robust primary care is so foundational to any healthcare system anywhere around the world, So, 89% of Americans believe that a personal relationship with their doctor is really important. And that's what we do in primary care. 88% support a health system that really emphasizes prevention in primary care and keeping people healthy before they get sick, and not just paying for procedures and whatnot. So currently primary care makes up about 6% of the spending in the US, which is abysmal. Studies have shown that 12, 15, maybe even 20% of spending would drastically improve the nation, the healthcare costs in the nation. So, patients with a primary care doctor who have about 33% lower healthcare costs overall. So that's huge. I mean, you multiply that times everyone in the nation. I think there's some estimates we could save almost $60 billion a year if everyone in the U.S. had a primary care doctor that they saw and had a good relationship with. So, it's so critical in so many different ways. So, obviously I'm biased. I love what I do. I love seeing patients every day. It's a lot of hard work. And the biggest issue, which most people watching this know, is that we have a shortage. We don't have enough primary care doctors. It's not emphasized enough within our system. So that's part of the goal of National Primary Care Week as well, is to really show the rest of the medical community, rest of the country, kind of what primary care is all about, how much fun we have in primary care, and how important it is to really improve everyone's health of our communities, of our nation. And I think to bring it all back, what we're doing right now, outreach in nice, I like it, Kim. Outreach to Puerto Rico and some of the other relief efforts we're doing is what primary care is all about. So that's all I got. I love it.
So here's what I've got. I've got primary care is the solution for healthcare in this country, and I truly believe it. I believe that we are the solution, and especially family medicine. We know that a lot of family docs who do primary care, who are the backbone of primary care in this country, along with some of our colleagues in internal medicine, pediatrics, and OBGYN, they really do serve not only the needs of the majority of problems that patients face every single day, but we do a lot of the work within the hospitals, within our jail system, within the urgent cares, within the emergency rooms, so many different areas within the SNFs and hospices. Alex, you do sports medicine. I mean, there's so much that we do in family medicine and primary care that every single person in this country needs a family doctor. And I hope that if we can get that message out, that would be amazing. And if we can learn from other countries that really, as Alex has said, spend more on primary care and have better health outcomes, isn't that what we want for our families? Isn't that what we want for our country? We want to have strong, healthy families. We need to have a strong primary care workforce in place. So please do check out Family Medicine for America's Health website, and we can post the link for that later on as well.
I totally agree. I think one thing people say to me is like, well, you can't possibly do everything. And one problem that I had as a medical student and a resident is I did want to do everything. I want to do everything in primary care, which is great. But it's important for people to know that, like, for example, I do primary care, but I also do have a sort of a specialization in sports medicine. But I don't do OB. I don't do any ER work. So, every single primary care doc doesn't do everything, you know, because I've had people say to me, well, you can't possibly do everything well. And each one of us individually doesn't do everything, but collectively we do everything. You take 5 family docs with sort of different areas of interest, and we could practically run a hospital. There's so much knowledge there. So I think that's a critical point to make, for people to understand that, you know, we all do primary care, but then we all have our own area of expertise and interests. And that changes over time sometimes as well. You know, early in career, sometimes you do more OB, and later you do a little bit less, and then you do more procedures at one point in your career. So for us as physicians, it really keeps us healthy mentally and emotionally as well, to kind of be able to do all these different things and kind of reinvent ourselves or redo parts of our career over time as well.